Sodium glucose cotransporter 2 inhibitors or SGLT-2 inhibitors are a category of drugs used for the treatment of type 2 diabetes. Canagliflozin, dapagliflozin, empagliflozin, and ertugliflozin are the drugs coming in this category. In proximal convoluted tubules in the kidney, there's a transporter known as the sodium glucose-like transporter 2 or SGLT-2. The sodium glucose cotransporter 2 is responsible for reabsorbing 90% of filtered glucose in the tubular lumen of the kidney. When this transporter is inhibited by SGLT2 inhibitors, the kidney is unable to reabsorb glucose. Instead, it causes glycosuria and the glucose is excreted out into the urine and lower blood glucose. Inhibition of SGLT2 also decreases reabsorption of sodium and causes osmotic diuresis. Therefore, SGLT2 inhibitors may reduce systolic blood pressure. However, they are not indicated for the treatment of hypertension. The most common adverse effects with these agents are female genital mycotic infections, for example, vulvovaginal candidiasis, urinary tract infections, and urinary frequency. Hypotension has also occurred, particularly in the elderly or patients on diuretics. Also, SGLT2 inhibitors can cause hyperkalemia and ketoacidosis. Canagliflozin is associated with increased risk of fractures and amputations. Dapagliflozin is associated with bladder cancer. Therefore, the use of dapagliflozin is not advised in patients with active bladder cancer. Also, these medications are contraindicated in individuals with recurrent urinary tract infections, such as in individuals with anomalies of the urinary tract, and in individuals with renal impairment.